in terms of like what you guys do and what your organization does, like that's kind of different from other like larger medical systems in the Boston area, how would you kind of like differentiate in that way?
Yeah, it's a great question. On a couple levels, I think, on the personnel level, we really focused a lot on clinician burnout,
Mhm.
which could be a whole different, conversation
A very
podcast.
valid conversation to have.
Yeah. So that's one of our top priorities is making sure we have an environment that's focused on clinician well-being because it's a really hard job that we do here. That's one angle, but in terms of the services, we are, like I said, OCD and anxiety specialists.
Mhm.
So there's a gold standard treatment called cognitive behavioral therapy with exposure and response prevention. It's a mouthful, but it's basically learning how to think differently and act differently so that your anxiety goes down over time. And that's a well-researched treatment. Unfortunately, it's hard to access in the community. A lot of researchers and advocates and clinicians are working to disseminate that so that it's more easily accessible, but still a challenge. So we specialize in delivering that gold standard treatment for anxiety and OCD.
Mhm.
And we also work with what's called treatment refractory OCD and anxiety, which are the cases that have gotten that gold standard treatment and haven't gotten better, which
Yeah.
isn't the majority, thank goodness, but there is a minority where other things are needed.
Yeah.
And that could be better assessment, where Teresa does a great job looking at kind of the cognitive profile, understanding if there's neurodiversity or learning styles that need to be better understood and addressed. Therapy is a learning environment, so your cognitive profile greatly matters even in terms of what we do in the office.
Yeah.
Could be more of a family systems thing that we need to get into, understanding trauma backgrounds. There's just so many comorbidities, conditions that show up with anxiety and OCD that if they're not addressed can get in the way of people feeling better. So
Yeah.
we're known for not only that gold standard treatment, but also being able to kind of look elsewhere and really explore what's getting in the way to stop people from thriving.